Prof, a very good morning to you. I deliberately wanted you to listen to that sound, that audio from yesterday. It's as clear as mud, as far as I'm concerned, in terms of what the department is trying to get the public to understand.
Good morning, Bongani, and I think you're being polite by calling it as clear as mud. It's total chaos and total confusion. And unfortunately, it's all underpinned because, truly said, the Department of Health does not seem to have a clear goal as to what it's trying to achieve with these regulations. If it's about trying to prevent infections, they've been completely agnostic to the experience in South Africa over the past 2 years, where all of these regulations have done very little in protecting people from being infected, because had they worked, we wouldn't have had close to 85% of the population, almost 9 out of every 10 people, being infected with the virus at least once since the start of the pandemic.
But surely, Prof, things like the mask mandate have gone some way in preventing the spread of infection?
Unfortunately, it might come as sad news, but really not, because the reason for that is if you want masks to work, but you need to wear the right type of mask, and you need to be wearing it correctly, and especially for variants such as Omicron, which is highly transmissible. What you're needing to do if you want to protect yourself from infection is wear the N95 or the KN95 masks, which are extremely expensive and even in short supply in healthcare facilities for healthcare workers who require it the most. But the type of cloth mask that we use, unfortunately, does not provide a proper seal around the nose and the mouth, and in fact, it doesn't filter out of microparticles in which the virus is, which you basically inhale. And we know that the main mode of acquisition of the virus is through the airborne route, literally inhaling the virus. So if you want to wear a mask and protect yourself against infection, and I'm not too sure whether there's good enough reason to try to continue protecting yourself against infection at this point in time, then you need to wear the right type of mask and you need to wear it correctly. And that is not the cloth mask, which 99% of South Africans wear, and they don't wear it correctly.
So what you're saying is, even though we're all wearing masks, it's nothing more than a decoration.
Unfortunately, that's the harsh reality. And again, like I said, had those masks been doing such a great job, we wouldn't have had 9 out of 10 South Africans being infected with the virus at least once. And it's not unique to South Africa. This morning, there was a study released from the United States, which shows that despite all of the masking and everything else in the United States, 2/3 of children have been infected with the virus at least once.
Just in terms of what the way forward seems to be now, government admitting that they needed more time, they need to consider a lot of the public comments that they have received. What do you make of the current proposals that are still being thought about by the department?
Like I said, it's a rehash of old regulations which have been spectacularly unsuccessful in protecting people from being infected. The sole goal in South Africa should be a focus on protecting high-risk individuals from being hospitalized and dying. We've reached a point where there's extensive amount of immunity across the population because of infection-induced immunity as well as vaccine-induced immunity. But we're still not where we are. We're getting at least 90% of people with underlying medical conditions and above the age of 50 vaccinated with at least 2 to 3 doses of vaccine. And that should be our sole focus, rather than fudging around a whole lot of regulations, which simply, unfortunately, in the South African context, does not reduce the force of transmission of the virus and the force of infection.
Do you accept at all, though, that, look, there's still a lot we don't know about this virus, possible mutations, new variants that may come along, and that we just need to be careful here, err on the side of caution than on the side of complacency?
Well, we know as much as what the scientists in the United Kingdom and United States and Western Europe know. We know as much as they. And what you've seen happening in those countries is they've pretty much opened up society, not because they're not concerned about new variants. New variants are going to arise. But the likelihood of a new variant arising that's able to evade that arm of the immune system that protects us against severe disease and has been fairly resilient in protecting us against severe disease is extremely low. And that's the reason why you see stadiums full up to capacity across Europe. It's not because they're not afraid of a new variant, but they understand the likelihood of that is extremely small, in addition to which a high percentage of the population have got protection against severe disease. And to be explicit, people that have been infected, past infection protects as well if 2 doses of messenger RNA vaccines in someone that hasn't had past infection against severe disease, as well as probably even better against mild COVID. So we've got extensive amounts of immunity, and we can't wish it away. We should welcome it. It has come at a huge cost, a loss of 300,000 lives in South Africa. But at the same time, it's something that prevails now, and we need to recalibrate as to what we're trying to achieve. We are not trying to prevent infections any longer. Yes, we need to do what's necessary, especially if you're at high risk of severe disease. You should still take precautions. But as a general population, we can't continue pretending that we're protecting ourselves against infections with using regulations, which, like I mentioned, unfortunately hasn't achieved much.
All right, Professor Shabir Mahdi there, Professor of Vaccinology at the University of the Witwatersrand.
Current events, developing stories,
tough questions.
Your voice making a difference.
This is Breakfast with Bongani Bingwa.